Hey everybody, I know that someone had requested to see a close-up of my brackets for whatever reason. I'm not good with taking close-up shots. I don't like taking close-up shots of myself, but here they are. So I hope that gives you a pretty clear indication of me having the ceramic brackets up top and the silver brackets on the bottom and the lovely elastics that I've been wearing that I talked about in my last video. Of course, I have nothing new to update because I just put up a new video on how I've been doing with the elastics. So far so good. I just kind of wanted to put it out there that I've been doing a lot of reading on the forum cardarchwire.com. It's a website that's specifically geared to adults that are undergoing the dental braces process, and it's really helpful because there's a lot of people on there that are able to relay their experiences on how they've been adjusting to wearing braces in adulthood. And there's folks on there from, their mid-20s all the way up into their late 50s. And like I mentioned before, I'm 35 years old. I embarked on this process August 17, 2010. You can check out the first video that I posted, which will give you an idea on why I decided to get braces. But all in all, I'm doing great with them, and it's been an interesting experience. I will say this, I was very naive going into this process. I thought pretty much all they were going to give me were some brackets and some wire, and that would be it, and they would just magically move my teeth. There's more to this process than I would have ever imagined. My background is actually in physical therapy, so I do have a health-related background. I do remember taking a lot of science courses like anatomy and physiology and biomechanics and the structure of joint function and whatnot. I didn't really realize this until I embarked upon the dental braces process, exactly how your teeth are able to move. If you don't know much about anatomy and physiology, I would encourage you to check out the specifics, specifically bone remodeling, because that's basically how your teeth are able to move. It's actually a complex, what am I trying to say? Case of bone remodeling. And all that is that you have osteoblasts, which are called bone building cells, and then you have osteoclasts, which are bone resorption cells. And actually that whole process is key or instrumental in how your teeth are able to move. Of course, your teeth are set in the bone and they're held in there in the midst of what's called the PDL, or the periodontal ligament. And that basically, this process, the ligament gets loosened and it allows your teeth to move within the bone or to move in a certain position. And you have the osteoblasts, which are the bone building cells. When your teeth are being moved, you have new bone being built on one side, and then you have bone being taken away or resorbed on the other side. So you have the osteoblast building bone, which are the bone building cells, and you have the osteoclasts, which are the bone resorption cells. And those two complex set of cells work together to allow your teeth to move into a new position. So that's basically what it is. It's simple anatomy and physiology, and if you've ever taken that class before, you know exactly what bone remodeling is all about. And I thought it was pretty interesting because I had no idea that process played a key role in how your teeth are able to move in the bone. So it's pretty interesting. I encourage you to read up on a little bit of this. Don't be so naive like I was going into this process about not knowing how everything worked. And I didn't know until I got knee deep into this and I started asking more questions and generally just got interested in the process. And I was extremely naive. Like I said, all I thought that they were going to give me were some brackets and a wire, and that would be it. Now I'm getting into the whole thing of them taking some brackets off and repositioning them to allow teeth to go in whatever direction that the orthodontist wants them to go in. But it's a pretty interesting process. But like I said, check out archwire.com. You can get a lot of encouragement from those that are going through the process like you. You can ask questions. You can research answers to questions that you may have been asked before. And it's just a really good resource because you know that you're not the only person going through this. There's somebody else that's also an adult that's going through the process as well, and that, you know, is having a hard time adjusting. So it's nice because we all pretty much give everybody support. And that's what this is all about. It's not so peachy keen to be wearing braces in adults. I mean, if I had it my way, I would have gone through this process when I was a teenager, but of course that didn't happen, and I'm undergoing it now. So you're never too old to undergo this process. Your teeth move naturally over the course of your life anyway, and why not have them move and be better alignment within your mouth, and you know, therefore you can better take care of your oral hygiene, and you can, you know, get your flossing done and easily. So definitely check that out. It's a great website. And that's it. Like I said, this wasn't a true update video. Someone just asked that I take a close-up picture of the braces, and I hope that I was able to do that. So until next time, thank you for checking out my video. And I will update like I promised in the next couple weeks. Take care, everybody. Bye-bye.